Hi, this is Swapna from TheHealthSite.com, and I'm here with Dr. Rishma Pai, who's a gynecologist at Lilavati Hospital in Mumbai. She's also the president of the Federation of Obstetric and Gynaecological Societies of India. And we are going to talk about safe sex. So we get a lot of questions from you guys about safe sex, about how to avoid pregnancy, about how to avoid STDs, and all those questions is something that Dr. Pai will answer today. So first up, Doctor, one of the most popular methods to avoid pregnancy is the withdrawal method. I just want to know how safe this is and how, guaranteed or not guaranteed this method is.
Yeah. I think this is one of the most, let's put it as basic methods of avoiding pregnancy. However, it's extremely unreliable because you know that even a small amount, even a drop of semen being deposited into the vagina will cause a pregnancy. Very often withdrawal is not in absolute time, it's a little bit delayed, and this method of withdrawal is notoriously inaccurate. So absolutely not recommended unless there's a crisis situation and there's nothing else or no other method that you can employ.
So a crisis situation is interesting because sometimes people say that they couldn't avoid it, and the other thing that they resort to in such situations then is an emergency contraceptive, right? An I-pill or something like that. So is that something that people should keep going to often?
I think other than in a rape situation, there is no crisis, according to me.
Okay.
I think most things can, and if you want to, you can definitely anticipate them. If you're in a relationship, if you are married, if any such situations, to not be prepared for sex is, I think, really being stupid or being caught unawares. So to me, emergency contraception is genuinely an emergency. Unfortunately, in today's times, in my clinic, when I ask people, so what method of contraception do you use? We use I-pill, doctor. That is not contraception, and it has disastrous consequences if it is used as a regular method of contraception. So most definitely people should be prepared. It's unfortunately that with the change in moral attitudes, with the increase in premarital sex, unfortunately there's no increase in knowledge and awareness about contraception. They absolutely have not gone hand in hand. So while it's acceptable in many situations today to have premarital sex, it is absolutely not gone hand in hand with contraceptive knowledge. So to me, emergency contraception should be used in a genuine emergency, because unfortunately it fails a large number of times. So every now and then I see girls who become pregnant despite having used emergency contraception, and there's a disruption in their period cycles. Either they're bleeding all the time or their period is delayed and then they're worried that they might be pregnant, and a large number of them are failing. Also, there is no protection from sexually transmitted infections.
Right.
So to me, it really fulfills a very, very small niche segment only.
But, and also I read somewhere that emergency contraception doesn't even work if you're overweight. Is that true? Because a lot of married women also resort to emergency contraception because they feel that because husbands refuse to use condoms and things like that. So that's one of the reasons.
Yes, unfortunately, because there's been such a media blitz, or there's been so much advertisement, which is fine, you create awareness, but at the same time there should be complete information about a thing. You can't just say, okay, the magical solution to all life's contraceptive issues is popping in an emergency contraceptive pill. It absolutely doesn't work. So it's very frustrating for us to see people having only 1/100th of the knowledge they should have about a product that they're very freely popping in.
Right.
So if you are ready for sex, you better be ready for the information, or you better take out the time to at least talk to a doctor to find out what it is that you're getting into. It's not a joke to have an unplanned pregnancy. It's definitely not a joke to have a lifelong sexually transmitted infection.
Right.
So do not take this casually. You make your life choices, that's fine. That's your choice. You make your choices. You do whatever it is that you choose to do. That's fine with us. No moral issues here. But to me, it's every girl's responsibility to protect herself. So if you're stupid enough not to take care to protect yourself, then you deserve what you get.
Okay, and I think that kind of hard-hitting message needs to go out to everybody these days, whether you're married, whether you're single, because like the doctor said, sex, once you're ready for sex, it's your responsibility after that. So coming to pills, which seem to be like the easiest thing because a lot of refusal to use condoms, and we'll come to condom allergies and things like that. But when you talk about oral contraceptive pills, a lot of my friends are very hesitant to use that because of the whole hormonal issues. They feel that if they continue taking pills, they don't know whether when they're ready to conceive, whether they will be able to or not. So is that a myth? Are there genuinely some issues over there, or people can take pills freely?
So what you're saying to me is absolutely true. It's unfortunate, but pills is equal to hormonal problems, is equal to cancer, is what has been ingrained in people's minds. Which is kind of ridiculous, because to me pills are one of the most effective contraceptive methods, one of the safest, the one which gives women complete control over their reproductive function. And today the pills, we get low dose pills, we get ultra low dose pills, we get various permutations and combinations of hormone pills. We can actually individualize treatment and suit it to you. So in fact, there are so many beneficial outcomes of contraceptive pills. For example, it will regularize your periods completely, reduce the pain and the bleeding during your menstrual cycle. It will make your skin really nice. It will make your hair better. It will give you, of course, almost 99+% protection from pregnancy. So to me, contraceptive pills have a lot more benefits than they have side effects. The side effects are rare and extremely, extremely infrequent. However, if you're going to not use the pills and become pregnant, let me tell you, the side effects or the long-term consequences of abortion, which you're going to do, are much, much more risky or dangerous than the side effects from a contraceptive pill. So you have to weigh the pros and cons of everything. Nothing in this world is perfect. But to me, today's contraceptive pills, the low dose, the ultra low dose pills, are extremely nice, very few side effects.
Okay, when it comes to condoms really, or IUDs and things like that, which is a better method? Because some things that you have to, like the wire that you have to insert for 5 years or 10 years, few people are hesitant to do that. Some find that more convenient. Some feel that they won't know how to use it well. What is it that you would recommend to couples in that situation?
There is no one method fits all or one size fits all at all. Okay. So condoms, for example, extremely nice. I tell every single young couple who comes to me that condom is an additional method which you must use. I always advise the girl, protect yourself first. So you use contraceptive pills, don't depend on the man at all. You be contraceptive pills, you are protected from pregnancy. However, insist on the man using a condom, because that's where you're protected from infections. So it's really a combination of the two things which works effectively, because condoms by themselves are not that effective in preventing pregnancy, but they're good for protecting from infections. So a combination of the two would be ideal. However, a young girl, 20, 25, I would never advise inserting anything inside her uterus. So copper T or intrauterine device is not recommended for a young girl, because when you put something inside the uterus, you might introduce an infection. There might be a heightened risk of infection. You don't want to take a chance with that at all. So copper T is good for somebody who already has one child, for example, and you're spacing your pregnancies. Then a copper T is good. You have your child, you put a copper T, 3 to 5 years, you're protected, you take it out, you plan your next pregnancy. But definitely not for young girls. So we definitely sort of individualize the contraceptive methods. We have a lot of other methods available today. We have vaginal rings. So these are these hormone vaginal rings. It's like a soft bangle which you can insert into the vagina and keep it there 3 weeks out of 4 in a month. And it's like a contraceptive pill. However, you don't have to eat a pill every day. You just insert this soft vaginal ring into the vagina. And you can actually not feel it there. It's like putting a tampon inside. So you can't feel it there. It sits there for 3 weeks. 4th week you take it out, you get your menstrual period, and then you reinsert it. So it's a good, effective sort of 3-week method and works well. It's just that there's no awareness, because unfortunately people don't seek counseling. They are embarrassed or awkward about it. Sometimes the guidance that they get is from the chemist. The chemist tells them what contraception to take, which is kind of ridiculous. So all it takes is one visit to the well-informed gynecologist who will give you all the information, the choices, and then you decide what works for you.
So how does the vaginal ring work exactly? Is it like a spermicide thing?
No. Spermicides don't work because there are in every Norman semen sample which is deposited after intercourse, there are probably about 100 million sperms.
Okay.
So there's going to be no jelly or no cream which is going to kill 100 million sperms. It doesn't happen that way. It will reduce the fertility, but it will not cause you protection, definitely. Yeah. So vaginal ring is actually a hormonal ring. It sits there, you put it right in just on the second or third day of your period, and it actually releases hormone, and it works on the cervical mucus. It makes that mucus thick so sperms cannot penetrate inside. It actually prevents ovulation. So it's like I said, a contraceptive pill, but instead of eating it, you're inserting it into the vagina and it's being released, the hormone slowly. Okay. So it's a hormonal method of contraception, but just like you have injectable contraception. So you have injectable once in 3 month contraceptive methods available. So once in 3 months you take a shot, and that will give you protection for 3 months from pregnancy. Okay. However, the injectables are better for a little older women or those who have already one child, because sometimes it upsets the period cycle a little bit, so I don't recommend it for young girls. So like I said, we have a lot of methods available. It's just that we need to individualize the treatment, and the person who can do that for you is your doctor.
Okay. So when it comes to condoms, some women say that they are allergic to the latex. And is there anything available for them? Can they use the female condom, or are there male condoms that they would not be allergic to? What do you recommend?
Yeah. So there are different varieties, and there are latex-free condoms as well. Not freely available in India, but you can access them.
Online, maybe?
Yeah.
Okay.
And unfortunately, female condoms have never really taken off. They are available in very, very few places. Again, imported ones, nothing available in India. Hopefully will come in very soon are implants. So implants are nice. It's like a little injection which you give in, and a little device which you implant under the skin, and that works for a period of 3 to 5 years. It releases a low dose of hormone. So essentially, more and more there is focus on long-term hormonal contraceptive. Also, newer pills are coming in. So there are many newer pills which will be, rather than normally a pill you take for 21 days and you stop for 7 days, whereas the newer pills you take it continuously for something like 3 months. So actually you get only 4 periods in a year, which is also a beneficial effect. You know, it reduces your problems which come with the period. It reduces a lot of diseases like endometriosis, which are aggravated by the periods, and it actually regularizes hormones, and it's very convenient to not have that many menstrual periods in a year. So there are lots of new things in contraception. It's just a question of awareness. Unfortunately, the awareness is from friends, from neighbors, from somebody who had pills and didn't become pregnant. How do you know that girl wasn't infertile to start with? You know, so I think lots of myths and misconceptions.
So what are some of the most common things, myths that people come to you with, and that you have busted for them, or some of the common blunders that people make when it comes to contraceptive choices?
Yeah, it's unfortunate, but even couples who are married for a couple of years have absolutely pathetic knowledge about contraception, and that's why sometimes I come on a little strong, because I get so upset that you have time for everything else and you don't have time for something so important as in controlling your reproductive ability, whether you want to have a baby or not, whether you want to protect yourself from infections or not. And people think of infections just HIV, and they don't think HIV will ever happen to them. However, there's a lot more to STDs than HIV. There's hepatitis B, which is as bad if not worse. There's hepatitis C, which is terrible. There's no treatment for these infections, viral infections. There's herpes, which I'm seeing huge amounts of. The kind of herpes I'm seeing today, when I graduated from medical school, I couldn't recognize herpes if I saw it. And now from 1 mile I can recognize it. That's the number of cases I see. So, other kinds of STDs. So there is human papilloma virus,
HPV,
which is, HPV, which is actually a causative agent for cervical cancer. So, all these things are there, and they're actually increasing because people are becoming, more sort of liberal in their sexual attitude. Multiple partners, many people go through. By the time they get married at the age of nowadays late 28, 30, some of them have had 2 or 3 partners, and so STDs are rampant, and it's unfortunate that even married couples with children will say to me that their method of contraception is I pill, which is really pathetic. So it's a lot of myths that we need to break, a lot of things, and sometimes you can't get across to people because they have decided that their neighbor with copper T had a problem, so they are going to get it. It's like that.
It's like that, yeah. So I want to talk about STDs a bit. One of the most important things that I want to really highlight is the doubt that people don't really ask. At what stage of intercourse do you really need to wear a condom to prevent STDs? Because people kind of get into the act and, they are involved with all kinds of foreplay. And then only during the final, stages do they really resort to using a condom.
Yeah,
and
I think the moment there is any intimate physical contact, the condom needs to be on, because even the pre-ejaculate, the fluid may contain infection.
Okay.
So essentially, prior to any kind of an intimate contact, there should be a condom on.
Whether it is oral sex or even just in the genital area, any point in time?
Oral sex is a little bit different because a lot of infections do not get transmitted that route.
Okay.
But one cannot be completely sure. So definitely prior to vaginal intercourse, the condom needs to be on.
Okay. Also, one of the most common myths that we have with regards to pregnancy is sex during a safe period or sex during periods. Both of these are also really common, and people think that it is your safeguard of protection against pregnancy.
See, first of all, safe period is hard to define because safe period is very limited. The safe period is only starting from the beginning of your period for the first 7 days and for the 7 days prior to your next period. Now, the next period, nobody knows when it's going to come. You may typically have regular cycles, and this particular cycle, suddenly your period may decide to get delayed. So what you consider safe period may not be that safe anymore. So you cannot calculate your safe period from the last period. You calculate your safe period from the next period, which is impossible. So unless somebody has menstrual periods which are like clockwork, you cannot actually practice safe period. And there's a very large window during which it is not possible to have safe sex.
Right.
So then it really limits you out to those last few days during and before your next period. So safe period, not really recommended. Yes, if you do a combination of methods, if you do safe period plus you do withdrawal and you use condom, then I would say you'd get a reasonably good protection.
Okay. And so whether it's during your periods or the safe so-called technically days before and after, it's not at all something that you would recommend?
It's not something I would recommend to young girls, because to me, when I see a young couple, it's so important that we don't ruin their entire mental and physical health by having an unplanned pregnancy or an STD very early on in their life. To me, that's important that we protect them right from there. So for me, for them to make some silly mistake, which then for the rest of their life they will regret, is really not acceptable. So to me, it's so important that you take out that 15 minutes and have a good consultation and understand what you're going to get into it. Then you make your choices. That's fine. But don't make blind choices. That's so unfair to yourself.
Okay, so anything that you would want to tell, the teenagers and the 20-somethings who are watching us now about contraception, about going to a gynaec, because recently we saw a lot of people looking for gynaecs who they could trust, right? Yeah. Because gynaecs often have, when people go to gynaecs, one of the most common things that you hear is they're so judgmental, we are really scared of approaching them because of all the things that they tell and, the way you're told off. So is there anything that they should do? Because they're not going in with a parent or with a husband.
Obviously not.
They're going in by themselves, and the whole moral judgment aspect becomes quite a big problem to overcome, really, because you're a teenager, like you're literally revealing your sex life to people, and it's almost like one call to your mother and does she know what's happening?
I don't think that's a possibility at all. Okay. I would never ever think of reporting a teenager to the parents. That doesn't happen. So that trust has to be there. Right. Obviously you have to seek out help from a person whom you trust. Right. However, so there's no morals here. I only feel very strongly about the girl at a young stage of her life, landing herself into a situation which she finds hard to cope. I think that's not fair. Very many times I have young girls. I do have a very, very large percentage of my clients who are very young. Mm-hmm. Some of them will come with their girlfriend, and it's so traumatic for them, and I feel sorry for them that they are in a situation, for example, if they have an unplanned pregnancy, and then they have to go through the whole trauma of deciding whether they want to do a surgical termination or they want to take medical methods of termination, which also are not easy. They're quite quite complicated, prolonged, likely to fail. So I feel very sorry to have them going through that problem. Or if I were to tell a 25-year-old that she's landed up with herpes, which now is going to be with her for the rest of her life, whatever she may do, it's really not very nice. So to me, it's really not about judgment at all. It's just I feel so strongly about wanting to protect them. I want them to know, I want them to be careful, I want them to be in command. I don't want anybody else to dictate to them what should be happening to them or how they should use their bodies, or, you know, nobody else should decide. They should decide, which is why very often I tell them, you know, take it in your hands. It's your life, your control. You take contraceptive pills or take whatever it takes, but you decide. Nobody else decides for you. So I think similarly for the men as well. Some of the men are so, you know, they are sexually active, but they're so ignorant about how, even if they want to protect their partner, they really don't know how to. So, you know, it's so important for us to have that little conversation as a friend or as a genuine person who cares to these youngsters. Because today everything is, you know, Google, you know, it's Dr. Google, and it's fine. I mean, you get your information from the internet, no problem at all. It's unfortunate that it's not, there's so much out there that they don't know how to filter out that information. Sometimes they pick up all the wrong things, or they get all the wrong messages, because you can get whatever you want from the internet. You want to hear a particular thing, you can hear that particular thing. So if you come to a doctor, the doctor will be able to filter out the information, give it to you in a capsule, what is relevant for you specifically. So I think there's nothing like a one-to-one with an understanding doctor.
So there you have it. You need to go consult a gynecologist. No matter how much you look up information on Google, on our site like TheHealthSite.com, you'll only have a lot of information which is generic. But when it comes to you, specifically something for your needs, there are a lot of methods out there that we are probably not even aware of at this point in time. And you need to consult trusted gynecologist. Do not be afraid to do that, especially if it's your first time. I think before your first time, it's something that you definitely need to consult a doctor for, because like the doctor said, you could have an STD which will be there with you for life. Same goes for a child, I guess, unless you decide to terminate. If you're pregnant, the child will be there with you for life. So I hope all of you who are watching this take this really seriously and definitely consult a doctor for all your contraceptive needs. Thank you so much for watching this video. If you like this video, don't forget to hit like, share and subscribe. Thank you.
Thank you.